Hi, I'm Dr. Scott Stoll, co-founder of the Plantrition Project. Just in full disclosure, there's no actual or potential relevant financial disclosures associated with this presentation. Our learning objectives for the course will be, number one, compare and contrast the most common interventions for the remission of type 2 diabetes. Number two, describe the components of the most effective lifestyle modalities. Three, we're going to review the research that demonstrates the remission of peripheral neuropathy. And finally, list any non-pharmacologic components of a program to reverse neuropathy. I think it's really important at the outset in discussing some of the modalities that will be included in this program to take a step back and understand that type 2 diabetes is really a multifactorial disease. There's an epigenetic component, this inheritable component that's a part of the epigenome that we get from our grandparents and our parents, but it's really the environmental component and the lifestyle choices that have an unraveling effect on our epigenome, exposing those susceptibilities and leading to the manifestation, type 2 diabetes and insulin resistance. In the environmental component, it's very important to recognize that there's multimodal impacts from the lifestyle choices on our microbiome, medications that might be utilized for the treatment of other conditions, food deserts where processed food is the predominant caloric intake, and the culture in which we live are also environmental impacts that lead to a greater susceptibility of developing insulin resistance. And very pertinent to this series and this lecture, lifestyle choices, such as type of food that we eat, our exercise choices on a daily basis, stress via the cortisol mechanism, and our regular habits all impact the susceptibility and development of type 2 diabetes. And because it is a multifactorial disease, type 2 diabetes responds to a multimodal intervention. And this is at the heart of lifestyle medicine, where the interventions include not just diet, but also stress management, exercise, modification of the environment, sleep, tobacco cessation, and the important aspects of community and relationship. So as we take a look at just some of the general dietary research, other than intervening with a whole food plant-based diet, let's take a look at some of the more common dietary lifestyle interventions that are often recognized in the diabetic literature today. One of the more common diets that's recommended for intervention, both of cardiovascular disease and type 2 diabetes, is the Mediterranean diet. The PREDIMED study, which was initiated in the early 1990s, is a very large Spanish study and started as a primary prevention trial, which included 7,447 Spanish participants aged 55 to 80 years old, and about 58% of that study were women. The population was at high risk for cardiovascular disease, but otherwise healthy. They were randomly assigned to a number of interventional groups that included one of three diets: a Mediterranean diet supplemented with extra virgin olive oil, a Mediterranean diet supplemented with nuts, and a control diet encouraging low-fat food items. So the trial was planned for 6 years, but it was terminated early after a median follow-up of about 4.8 years demonstrated that both Mediterranean diet groups reached a statistically significant reduction in the rate of cardiovascular endpoints. And so it's an important research study that has continued on into the 21st century and is often recommended as a primary prevention strategy. Looking specifically at the research on diabetes, the PREDIMED study found that hemoglobin A1Cs were reduced by about 0.3 to 0.47%, with a noted improvement in insulin sensitivity. There was a 20 to 30% reduced risk of developing type 2 diabetes for people utilizing the Mediterranean diet. They also found that about a 5% energy increment from saturated fatty acids was consistently associated with a twofold higher risk of type 2 diabetes. And that's important as we consider information later in this presentation when we talk about the use of paleo or keto diets. They also found in the PREDIMED study that per each 5% increase in energy intake from animal fat, the risk of type 2 diabetes increased by 26%. Again, another important finding in relationship to the popular paleo and keto diets today. And then also supportive of the plant-based diet, they found that legume and lentils inversely associated with type 2 diabetes incidence. The benefits of the PREDIMED diet They showed there was lower cellular and plasma inflammatory markers related to atherosclerosis at both 3 and 5 years, and that people liked the diet. There was a very high degree of long-term adherence. Now, some of the downsides of the Predimed, there's confusion over the components of Mediterranean diet. And I think that we find this as practitioners, and I will frequently ask my patients, what is a Mediterranean diet? And the first 3 items on their list are olive oil, wine, and pasta. Certainly not the optimal foods to prevent and reverse either heart disease or type 2 diabetes. So I think there's some general confusion because of our Western interpretation of the Mediterranean diet. There are some also methodological issues around the low-fat groups. We won't go into any more detail, but just for your information, and it's worth going back and reading some of the commentary articles. Also, we see from the Predimed research in the Mediterranean diet that it prevents and slows diabetes, but there's limited research documenting reversal or remission. And finally, the calorie density with some of the foods like olive oil and some of the potential refined foods like pasta can be problematic, especially in people that are trying to lose weight. Well, today we have seen an explosion of popular diets recommending both high protein and high fat. So today, the high protein diet is often recommended in many healthcare clinics and hospitals around the country. And in fact, in the VA hospital, there was a recommendation for the utilization of a high-fat, high-protein diet for the treatment of type 2 diabetes. This is based upon some studies that show improved measures and short-term studies looking at weight loss, reduced insulin, and improved glycemic control. However, the health professional study noted a 37% increased risk of diabetes on a low-carbohydrate diet. If we compare a high-protein diet versus a high-carbohydrate diet, such as the study that was looking at the comparison of these 2 diets, it's interesting to go into the methods to find out what actually they were utilizing as the dietary intervention. In the high-protein diet, they were utilizing a 30% protein, 40% carbohydrate, 30% fat diet. In the high-carbohydrate diet, they had reduced the protein down to 15% with 55% carbohydrate and 30% fat. So really no difference in the fat intake, which is important when we understand some of the insulin resistance associated with intramyocellular fat. Well, this study found that there was a 100% remission of prediabetes in the high-protein diet and a 33% remission in the high-carbohydrate diet at 6 months. But what are the risks of utilizing a dietary strategy like this? Well, there are some increased risks, as we have seen in longer-term studies looking at the higher saturated fat intakes associated with high meat-based diet. And they are elevated cholesterol, renal disease due to the increased acid load. There's an increased risk of cancer associated with especially processed and red meat, increased calcium loss due to the acid load and calcium utilized as a buffer for that increased calcium load in the body. We've seen that high-protein diets can contribute to long-term insulin resistance, endothelial injury, and disrupt the microbiome, which is one of the primary supporters of the immune system. So I'm just highlighting a few of the studies on high-protein diets. There are a number of other studies that have looked at high-protein diets and shown short-term improvements in insulin resistance and insulin sensitivity. But we need to step back and look at some of the more negative consequences of these diets, especially long-term. So a large systematic review that was published in 2017 looking at a meta-analysis of dietary carbohydrate restriction in patients with type 2 diabetes. And the authors concluded the greater the carbohydrate restriction, the greater the glucose lowering, a relationship that has not been demonstrated earlier. Apart from this lowering of hemoglobin A1C over the short term, there's no superiority over low carbohydrate diets in terms of glycemic control, weight, or LDL cholesterol. And so again, it's highlighting the fact that the only benefits of a high protein diet in this case, or a low carbohydrate diet, which can also include the ketogenic high fat diet, is a short-term lowering of hemoglobin A1C. But again, no superiority in terms of glycemic control, weight, or LDL cholesterol. So further, if we look at other large meta-analyses and systematic reviews that are looking at the long-term benefits of high protein diet, we see in this critical review of low carb. So a large systematic review So further, if we look at other large meta-analyses and systematic reviews that are looking at the long-term benefits of high-protein diet, we see in this critical review of low-carbohydrate diets that the total energy intake remains the primary dietary predictor of body weight. So low-carbohydrate diet appears to have no difference from a high-carbohydrate diet in terms of metabolic markers and glycemic control. Very low carbohydrate diets may not be sustainable over a medium to long term, as carbohydrate intake in diets within studies often converge toward a more moderate level. The variable quality of studies included in the meta-analysis likely explains previous inconsistent findings between meta-analyses. So this is an important new review looking at low carbohydrate diets that is describing the only benefit in the low carbohydrate diet groups is a lower total energy or calorie intake, which leads to the weight loss. And with weight loss, we know that there will be an improvement in glycemic control generally. However, as we've seen, that is the only short-term benefit. And as this study rightly points out, the long-term adherence to a very low carbohydrate diet is not sustainable. And what we see in patient populations as they go off of these low carbohydrate diets, they have over time, especially on a high fat diet, increased the intracellular fat, and they may have a rebound in insulin sensitivity as they begin to shift their diet towards a more moderate level. And in 2018, in a study published in Lancet funded by the NIH, they had this conclusion that low carbohydrate dietary patterns favoring animal-derived protein and fat sources pork and chicken, were associated with a higher mortality rate, whereas those that favored plant-derived protein and fat intake, such as vegetables, nuts, whole grains, were associated with lower mortality, suggesting the source of food notably modifies the association between carbohydrate intake and mortality. And so the short-term and short-sighted vision of the low-carbohydrate diet to simply impact insulin resistance and improve glycemic control by those utilizing ketogenic and paleo diets misses the mark of long-term health, especially cardiovascular health and cancer risk. And so the low-carbohydrate diets dramatically increase the risk long-term of those diseases in patient populations, especially with type 2 diabetes and compromised vascular systems. So in conclusion, while the low-carbohydrate diets may show some short-term benefit, principally in weight loss due to calorie restriction, and secondarily due to weight loss with some improvement in short-term hemoglobin A1Cs, long-term, the high-protein or high-fat, low-carbohydrate diets are at much greater risk for secondary diseases in a person living with diabetes, such as cancer and heart disease. Another common intervention today for people living with diabetes is gastric bypass. And I just wanted to start with this first slide just to highlight several of the more common surgical procedures that utilize gastric bypass as a means for weight reduction and control of type 2 diabetes. So first, there's the adjustable gastric band, where a band is placed at the junction of the upper pole of the stomach. Second is the Roux-en-Y gastric bypass. And third, we have the vertical sleeve gastrectomy. And so these are three different types of surgical procedures that are utilized in gastric bypass today. As we'll see in some of the research that we're talking about, the Roux-en-Y is often commonly used in gastric bypass and is a part of the larger studies on type 2 diabetes. So in general, looking at gastric bypass and weight loss, we see that there is a significant reduction in A1C, all-cause mortality, and medication requirement from 31.8% to 8.7%. In a retrospective review looking at more than 4,000 adults with uncontrolled or medication-controlled type 2 diabetes, the study found that 68% experienced initial and complete remission within 5 years, and 35% redeveloped type 2 diabetes over 5 years. They also found some improvements in cardiovascular risk factors. And so there is benefit in gastric bypass. However, the redevelopment, the recidivism rates are also a challenge, as we'll see in further studies. A study published in the New England Journal of Medicine looking at weight and metabolic outcomes after 12 years following gastric bypass. Again, they found very high remission rates early on, 75% at 2 years, but a slow slide, 62% at 6 years, 51% at 12 years. Another long-term study looking at the benefits of gastric bypass in the prevention or remission of type 2 diabetes have found varied numbers. 30% at 15 years in the Swedish obese subject study and 29% in the Stampede study. And so we see that there is a recidivism rate that can be fairly significant after gastric bypass. On the positive side, there is a lower risk of obesity-related cancers and a lower all-cause mortality. The Crossroads trial is another large randomized control trial that utilized an intensive lifestyle medicine intervention program, which was 12 months in length with in-person telephone-based programming that also focused on behavior modification and counseling. It was a combination of both diet and exercise training. And this was compared against Roux-en-Y gastric bypass. Now, just one side note, as we look at the intensive lifestyle intervention in this study, it was not a whole food plant-based diet which would optimize the outcome. So the authors concluded the most impressive benefit of surgery compared with the lifestyle intervention was in ameliorating diabetes, even though by chance the surgical group started with a duration of diabetes nearly twice that of the lifestyle medicine group, which biases against the surgical superiority. So they found a 10-fold increase in remission rate in the surgical group compared with the lifestyle medicine intervention group. And one of the limitations of this study is that it was only 12 months in duration. The other piece that we don't fully understand and would have to dig even deeper than the methods provided in the study is the types of dietary counseling and guidance that were given to the intensive lifestyle medicine intervention group. But it's an important study to understand that the surgical group had a outcome to the lifestyle medicine intervention group. In another study, a randomized controlled trial, both at 2 and 5 year outcomes from 4 different teaching hospitals called the Diabetes Surgery Study, their goal was a hemoglobin A1C of less than 7.0. They found that in the surgical group, 43% of the people achieved all of the beneficial outcomes with a reduction in A1C and weight versus 14% in the lifestyle medicine intervention group. However, there were 2 times as many adverse events in the surgical group, including falls and fractures. They also found more nutritional deficiencies in the surgical group, including iron, albumin, calcium, vitamin D, despite the use of supplements for these deficiencies. And so this highlights that even though the surgical outcomes in these 2 studies, both the Crossroads and the Diabetes Surgery Study, showed superior outcomes to a lifestyle intervention group, there were negatives to that, including nutritional deficiencies and adverse events. So the surgical group is not without significant risk. As we see in the short term, even at 5 to 7 years, the outcomes over the lifestyle medicine intervention groups are superior. So there are several negative outcomes associated with surgery, and they're important to recognize because although the surgical intervention may have better outcomes in the short term, these adverse events and negative health outcomes do increase the risk of certain nutritional deficiencies and potential complications long term. In looking at bone health, the research has shown that individuals with type 2 diabetes treated by Roux-en-Y gastric bypass or surgery compared to individuals with type 2 diabetes of similar age and body composition have lower bone mineral density, lower bone strength, and increased levels of several bone turnover markers. This puts them at an increased risk of fractures, and this is in fact what the research shows, that people with gastric bypass have an increased incidence of fractures. The gastric bypass also has shown that increases the risk of nutritional deficiencies despite the use of supplements to counteract those deficiencies. And in conclusion, the Roux-en-Y gastric bypass maintains significant differences from lifestyle and medical management in outcomes after 5 years, but with diminishing effectiveness, according to studies published in 2018 and 2019. And I would add to that, and also with increased risk of fracture and nutritional deficiencies. Note here, the lifestyle medicine intervention programs that are utilized in these research studies tend to be lower on the intensive scale as we might qualify them. This tends to be more generalized counseling, utilization of the American Diabetes Association diet, and with less emphasis perhaps on sleep and stress reduction. And so while these studies are highlighting the benefits of gastric bypass over lifestyle intervention, I believe an interesting study would be the comparison of gastric bypass against an intensive lifestyle medicine intervention program that might be recommended by the American College of Lifestyle Medicine. So shifting gears, if we think about diabetic peripheral neuropathy, and for those of us that have treated this disease, it's very difficult to manage and it causes significant disruption in quality of life for our patients. The pain can make it difficult to ambulate, can make it difficult to sleep, it can interrupt sleep patterns, which again is a stressor on the body, increasing cortisol long term. And the medications that have been approved for the use of diabetic peripheral neuropathy come with significant side effects, including weight gain. So there's not a great way to manage diabetic peripheral neuropathy. There are a number of alternative treatments that are used today, and again, with inconsistent outcomes. So diabetic peripheral neuropathy, just as some background, really is a disease of the microvasculature in people living with type 2 diabetes. And the microvasculature that supplies the peripheral nerves, and especially the myelinated fibers of those peripheral nerves, is the vasa nervorum. And essentially what's happening, this is an endothelial cell injury with a decreased production of nitric oxide, causing vasoconstriction and inflammation within those arteries. And so we have a decreased flow of both oxygen and nutrients to the myelinated peripheral nerves. Over time, then, we begin to have damaged unmyelinated peripheral nerves, evidenced in slowed nerve conduction velocities and the physical symptoms of numbness, hypersensitivity, pain, and even atrophy over time. A lifestyle medicine intervention along with So diabetic peripheral neuropathy, just as some background, really is a disease of the microvasculature in people living with type 2 diabetes. And the microvasculature that supplies the peripheral nerve. A lifestyle medicine intervention along with a whole food plant-based diet can be very powerful in not only improving hemoglobin A1C levels, but also improving symptoms associated with diabetic peripheral neuropathy. In 1994, Milton Crane and Clyde Sample did a very interesting study where they isolated 25 people in a controlled environment for 25 days and measured the improvements in their peripheral neuropathy symptoms. And they found that with an intensive intervention, 81% of the people reported a significant improvement in their symptoms, including improvement in numbness. And this occurred in just 4 to 16 days. Now, this is an important note that I like to point out in this study, that the improvement came in just 4 to 16 days. And the awareness that I often carry in my mind when I'm seeing patients is that despite having symptoms for 1 year, 5 years, or 10 years, that in just a very short period of time, 4 to 16 days, their symptoms can improve significantly, as can their quality of life. And so I like to encourage my patients that this intervention may not take years to recover their quality of life, but it can happen in a very short period of time. Also important in this study, they found that 71% of people maintained the dietary change for at least 4 years. So this is an important commentary on the adherence and the low recidivism rate in a study where people have experienced benefit through a lifestyle intervention. In another randomized control trial, this one 20 weeks in duration, utilizing a plant-based diet for diabetic peripheral neuropathy, they found statistically significant improvement in pain scores, pseudomotor nerve conduction, which implies an improvement in myelination in this 20-week period of time, and then statistically significant improvements in quality of life over the control group. In another interesting study from Iran, again looking at the reversal of diabetic peripheral neuropathy, utilizing a lifestyle intervention and whole food plant-based diet, this one from an interventional trial in 2018, found that in patients with severe pain from neuropathy, all of them reported some improvement, and by the end of the study, they were reporting only the persistence of mild to moderate pain. In the study, those with mild symptoms, and the total was 6, they had complete resolution of their symptoms, And of the 13 people with moderate neuropathy at the beginning of the study, 5 reported complete resolution, 8 reported only mild pain at the end of the trial. And this is in comparison to the control group, where all of the people reported their pain was at least the same, if not worse, by the conclusion of the trial. And so again, it's an important commentary in this study that even those patients with severe neuropathic pain can experience benefit through a lifestyle medicine intervention utilizing a whole food plant-based diet. And so all of our patients have the opportunity to experience improved quality of life through this important intervention. So when we think about an intensive lifestyle intervention, we remember that diabetes is a multimodal disease and a lifestyle intervention program that utilizes both diet, exercise, stress reduction, managing sleep, and if necessary, cessation of substances. It becomes a comprehensive solution that not only improves insulin resistance and type 2 diabetes, but it also enhances the quality of life for the individual that has been a part of the intervention. We also see that the application of that lifestyle intervention reduces the risk of cancer, is the same treatment for those living with autoimmune diseases, and can improve or send into remission autoimmune diseases. Because dementia and Alzheimer's are vascular diseases, the same lifestyle intervention has benefits for those. Macular degeneration, musculoskeletal system, and heart disease all improve with the same intensive lifestyle intervention. And so many of our patients don't come to us just with type 2 diabetes. However, the benefit of this intensive lifestyle intervention is that it improves all of their diseases and we enhance their quality of life. And so I think that's what makes me, and I think all of us, passionate about utilizing this as a primary intervention tool for our patients living with type 2 diabetes. So in general, some of the dietary guidelines that would be a part of an intensive lifestyle intervention would be an emphasis on whole plant-based foods. Again, focusing on the low-calorie density plant-based foods to optimize weight loss. And so the focus is on intact grains only and avoiding processed grains. This diet is inherently a high-fiber diet, and generally people eating a whole food plant-based diet are going to have more than 50 grams of fiber per day. And that's juxtaposed against the research that shows that most people today are in the 15 to 20 to 25 grams of fiber per day. Typically, we recommend 1 cup of beans or lentils per day because the resistant starches are broken down by the microbiome, again, producing butyrate and short-chain fatty acids that improve glucose management over the course of the day. 1/4 cup of raw seeds or nuts 3 to 5 times per week. And again, raw, unsalted, small handful used as a addition to a salad or a condiment, but not to eat nuts because of the high caloric density. Looking to utilize low saturated plant sources of fats and adding in some plant sourced fats such as flaxseed, chia seed, or even hemp seeds. Focusing on a wide variety of colored vegetables and fruits because the phytochemicals, antioxidants can be very beneficial both in vascular health and reducing inflammatory markers. Spices, herbs for flavor are very important, and some of these spices, such as cinnamon and turmeric, have an important reduction in insulin resistance, and some of this is thought to be due to the anti-inflammatory effect of the spices and herbs. This diet is low glycemic and low sodium because no salt is added. And in this way, this whole food, minimally processed diet is the best primary intervention for people living with type 2 diabetes. In addition, and has been covered in other units in this course, we see that the addition of activity, especially about 150 minutes per week, that is optimally after meals, is beneficial. And aerobic exercise has been shown to improve symptoms and promote regrowth of small cutaneous nerve fibers. And so the exercise is not only beneficial for reduction of inflammation, weight loss, but the exercise also improves the neuropathic symptoms for someone living with diabetic peripheral neuropathy. And generally, as a part of an intensive lifestyle intervention, we recommend stress reduction, optimal sleep of 7 to 8 hours per night, and community and regular support and follow-up. Very critical component is getting tied into community and being connected with support groups and supportive people. In summary, we have compared and contrasted the most common interventions for the remission of type 2 diabetes, described the components of the most effective lifestyle medicine modalities, reviewed the research that demonstrates the remission of peripheral neuropathy, and finally listed any non-pharmacologic components of a program to reverse neuropathy. Thank you for spending time going